Good morning and welcome to Health Time with Nurse Becky. My name is Beckie Freiberg and I'm the faith community nurse here at Derry Church. Today we are talking about heart health, heart disease, and what we can do to keep our hearts healthy. Oops. And the scripture reading for today says, "Above all else, guard your heart, for everything you do flows from it." This is Proverbs 4:23. Okay, let's get started. Heart disease is a catch-all phrase for a variety of conditions that affects the heart's structure and how it works. The most common type of heart disease in the United States is coronary artery disease, or CAD, which affects the blood flow to the heart. Decreased blood flow can cause a heart attack. Heart disease is the leading cause of death in the United States. Coronary artery disease is a type of heart disease where the arteries of the heart cannot deliver enough oxygen-rich blood to the heart. About 20.5 million adults have coronary artery disease, making it the most common type of heart disease in the U.S., according to the CDC, Center for Disease Control. Coronary artery disease can affect both the large and small arteries of the surface of the heart, and it is caused by the buildup of plaque, cholesterol on the inside walls of the arteries. And then it can totally or partially block blood flow to the heart, which can lead to a heart attack. For most people, coronary artery disease is preventable with a heart-healthy lifestyle and medications. Risk factors for the heart disease: high blood pressure, high blood cholesterol, overweight or obesity, prediabetes or diabetes, smoking, lack of physical activity, unhealthy eating habits. Family history is a really big one. Age 55 and older for women and age 45 and older for men. Each risk factor increases your chance of developing heart disease. The more risks you have, the higher your overall risk. Some risk factors cannot be changed, but others can be modified. You can make these changes gradually, one at a time, but making them is just really super important. So now we're going to talk about high blood pressure or hypertension. High blood pressure puts you at risk for heart attack and also for a stroke. High blood pressure is when the force of blood pushing against the walls of the blood vessel is too high, resulting in damage to the heart and blood vessels. Blood pressure is the pressure of blood pushing against the walls of your arteries. Arteries carry blood from your heart to other parts of your body. Blood pressure normally rises and falls throughout the day, but it can damage your heart and cause health problems if it stays high for too long. So I have a little video here that explains a lot of things.
It's a beautiful fall evening. The sun is setting. The dog finally stopped barking. Life is good. But inside, there's trouble brewing, and Emma has no idea. Although she feels fine, like her father, Emma is one of the 67 million adults in the U.S. with high blood pressure, or hypertension. Just like her radiator that's on the fritz, Emma's heart is working overtime to get the job done. Let's have a look. The heart is the pump in our bodies, delivering blood to the entire system through a set of pipes, or blood vessels of all sizes. Smoking, high cholesterol, diabetes, obesity, physical inactivity, family history, and increased age all contribute to these blood vessels, or our pipes, becoming less elastic. The more blood our heart has to pump through stiff, narrowing arteries, the higher our blood pressure. When the force of the blood against our artery walls is too high, life-threatening health problems can result. Problems like kidney disease, heart disease, stroke, even heart attack. Can Emma get her pressure down before it's too late?
Hypertension puts you at risk for heart disease and stroke, which are the leading cause of death in the United States. In 2001, hypertension was a primary or contributing factor of 691,095 deaths in the U.S. This is why hypertension is called the silent killer. Nearly half of adults have high blood pressure, but only 1 in 4 have their high blood pressure under control. And high blood pressure costs the U.S. about $131 billion each year. Here is a slide of the categories of high blood pressure according to the American Heart Association. More men than women have high blood pressure. Blood pressure is measured by using 2 numbers. The first number is the systolic blood pressure, and that measures the pressure in your arteries when your heart beats. The second number, or the diastolic, down for diastolic, measures the pressure in your arteries when your heart is at rest between beats. If a measurement reads 120 systolic and 80 diastolic, you would say 120/80. The higher the blood pressure, the more risk you have for other health problems such as heart disease, heart attack, and stroke. So, normal blood pressure is a systolic of 120 or less, and a diastolic of is 80 or less. Elevated is 120 to 130, and diastolic less than 80. High blood pressure, or stage 1, starts at 130 to 139 to 80 to 89. High blood pressure, stage 2, is 140 or higher, or 90 or higher. And this is usually when the doctor will start you on some sort of medication or lifestyle modification. And a hypertensive crisis, it's consult your doctor immediately, is if your systolic blood pressure is 180 or higher and your diastolic higher than 120. That's the time to go to the emergency room, seek help immediately.
Like millions of Americans, Emma was living with high blood pressure and didn't know it. There were no early warning signs or symptoms. But Emma's heart was working overtime, putting her at risk for heart disease and stroke. Following a physical, Emma was diagnosed with high blood pressure, also called hypertension.
People of all backgrounds can develop high blood pressure. Treatments differ based on risk factors including age and family history. But hypertension can often be controlled with healthy habits and medication when necessary. Eating more fruits and vegetables, following a low-salt diet, exercising regularly, and quitting smoking are often the first lines of defense to control high blood pressure. Your doctor may prescribe 1 or more medications to help lower your blood pressure to normal. Some rid the body of extra sodium and water. Others reduce the heart rate or relax the blood vessels. Always take medications exactly as prescribed and don't skip doses. While medications can effectively lower blood pressure when taken correctly, each type has potential side effects for some people. You might feel tired or have trouble sleeping. You may experience a dry cough, stuffy nose, leg cramps, frequent urination, or headaches. If you have side effects that don't go away with time, don't just quit taking your medication. Talk with your doctor and pharmacist, as there may be other medications or different doses that can control your blood pressure and have fewer or no side effects. Focus on the benefits. Taking your medication regularly will lower high blood pressure and protect your brain, heart, and kidneys from life-threatening consequences like stroke or heart attack, often the first scary signs of hypertension when left untreated. Control your blood pressure and reduce your risk by knowing your goal numbers
and monitoring your blood pressure at home or at your local pharmacy in between doctor's visits.
How's Franny?
She just graduated from obedience school.
Pharmacists play a key role in working with your physician to improve blood pressure management. We can address medication concerns and challenges. So talk to us about your treatments and goals outlined by your doctor. If taking your medication feels like a chore, don't just stop taking it. We can counsel you on working through side effects or determine when you need to see your doctor about possible changes in your medications. And we'll share healthy lifestyle tips to keep you on track. Whether you monitor your blood pressure at home or in the pharmacy, we're here to discuss your numbers and provide guidance. Okay, Emma, you're all set. I'll see you back here soon. Visit millionhearts.hhs.gov to team up with your pharmacist to bring your blood pressure down.
Okay, this one shows the other areas of the body that can be affected by high blood pressure. It would be the brain that could cause a stroke, vision loss, heart failure, heart attack, kidney disease, and sexual dysfunction. So you see, high blood pressure can affect so many different organs of your body. So it's important to know your numbers and help keep your blood pressure down. So let's go on to here. And what is a heart attack? It is when this is what a heart attack is when the heart suddenly stops pumping blood effectively due to a decreased blood supply to the heart. And then what is a cardiac arrest? A cardiac arrest is when the heart stops pumping blood suddenly. A heart attack can cause a sudden cardiac arrest, or it can be caused by arrhythmias or irregular heartbeats that prevent the heart from pumping blood. The main cause is atrial or ventricular fibrillation or tachycardia, which is high heart rate. Heart attacks are very common, and according to the CDC, more than 800,000 people in the US will have a heart attack each year. Symptoms of a heart attack or cardiac arrest can include angina or chest pain that feels like pressure, squeezing, tightness, or burning. The chest pain is sometimes related to physical activity. The pain or discomfort can also spread to your shoulders, arms, jaw, neck, or back. Cold sweats, dizziness, lightheadedness, nausea, or a feeling of indigestion, neck pain, shortness of breath, weakness. Women are less likely to experience chest pain and instead are more likely to experience dizziness, extreme tightness, nausea, pressure, tightness in the chest and stomach, pain, and many times jaw pain. Sometimes these symptoms will go away with rest and come back with activity. Chest pain or discomfort that does not go away or occurs while you are resting could be a sign of a heart attack. If you do not know whether your chest pain is angina or a heart attack, call 911 right away, and all chest pain should be checked by a health provider. If someone is having a cardiac arrest, activate the 911 system. Start high-quality CPR and send someone for the AED, then follow the prompts. Cardiac arrest is a medical emergency. 9 out of 10 people who have a cardiac arrest outside of the hospital die, and often within minutes. A person may be having a cardiac arrest if they collapse suddenly and lose consciousness, are not breathing, or breathing is ineffective, or they are gasping for air, do not respond to shaking or shouting, and do not have a pulse. The main cause of cardiac arrest is ventricular and atrial fibrillation or ventricular tachycardia. Risk factors include coronary artery disease, heart valve disease, congenital heart diseases, and arrhythmias. Half of people who have cardiac arrest do not know they've had a heart problem. Most people who have cardiac arrest do not receive treatment quickly enough to survive, sadly. What is a stroke? A stroke occurs when blood flow to the brain is blocked or there is sudden bleeding in the brain. There's two types of strokes. Ischemic stroke is due to a blockage or clot. The brain cannot get oxygen from the blood. Or hemorrhagic stroke occurs because of sudden bleeding, resulting in pressure on the brain cells, resulting in damage to them. Just under 90% of all strokes involve blocked blood vessels. Strokes are further classified based on where in the brain the blockage or bleeding occurs. Remember, stroke is a medical emergency. Most strokes are due to blocked blood vessels. Strokes can cause lasting brain damage, long-term disability, and even deaths. Signs of a stroke can range from mild weakness to paralysis or numbness on one side of the face or body. Other signs may include a sudden and severe headache, sudden weakness, trouble seeing, and trouble speaking or understanding speech. If you think someone is having a stroke, call 911 right away. Do not attempt to drive them to the hospital or let someone else drive. Call an ambulance so that medical personnel can begin life-saving treatment on the way to the emergency room. During a stroke, every minute counts. At the hospital, a stroke team will assess the condition and treat your stroke with medicine, surgery, or another procedure. Your recovery will depend on how serious your stroke was and how quickly you were treated. A rehabilitation plan may help get you back to what you used to do before you had a stroke. And here's a little video that talks about strokes here. Be fast.
You already know that staying in shape is one of the best ways to keep your body healthy. But did you know that goes for your brain too? The healthier you are, the less likely you are to have a stroke. Contrary to popular belief, strokes don't just happen to the elderly. They could occur in just about any of us, although some of us are obviously more susceptible than others. So, who is more susceptible? Well, it really all comes down to risk factors. Now, some risk factors are just a part of life. They are part of what makes you you, and you can't do a darn thing about them. We're talking about your age, your gender, good old family history, untreated heart disease or atrial fibrillation. That's irregular heartbeat for those of us without a medical degree. But there are plenty of risk factors that you do have some control over. I'm sure you know most of these already. But humor me. I'll promise to make it quick. Stop smoking, moderate alcohol consumption, control your blood pressure, lower and manage your cholesterol, stay physically active, improve your diet, control your blood sugar levels if you have diabetes. Right. So now we understand who's at risk. But equally important is learning the signs of a stroke so you can take action immediately. Be fast. Yup, it's an acronym. Let me spell it out for you. B equals balance. Is there a sudden loss of balance? E for eyes. Is there a sudden loss of vision in one or both eyes? F equals face. Does the person's face look uneven? A for arm. Does one arm drift down? Ask the person to raise both arms. S for speech. Does their speech sound strange? Ask them to repeat a phrase. And T for time. There you go. You knew that one was coming, didn't you? Every second, brain cells die during a stroke. Time is brain. So, what do you do at the first sign of someone having a stroke? You dial 911. There is no time to waste. So remember, at first signs of stroke, be fast.
Remember, be fast, every minute counts. Heart disease prevention. Let's talk about some ways that we can keep our heart healthy and in good working order. Smoking. Smoking is the single most preventative cause of early death in the United States. Chemicals in smoke cause the blood to thicken and form clots inside of veins and arteries. Smoking causes an instant and long-term rise in blood pressure, heart rate, reduced blood flow to the heart, and damages blood vessels. Smoking also doubles the risk of a stroke. Bottom line, stop smoking. Secondhand smoke can be dangerous too, so stay away from that. Smokers are more likely than non-smokers to develop heart disease, stroke, and lung cancer. Estimates show smoking increased the risk for coronary heart disease by 2 to 4 times, for stroke by 2 to 4 times, of men developing lung cancer by 25 times, of women developing lung cancer by 25.7 times. And smoking causes diminished overall health, increased absenteeism from work, and increased healthcare utilizations and cost. Physical activity. Less active, less fit people have a 30 to 50% greater risk of developing high blood pressure, and we all see what high blood pressure can do to you. Inactivity is a significant risk factor for cardiac vascular disease. It ranks similarly to cigarette smoking, high blood pressure, and high cholesterol. Doctors recommend at least 150 minutes of physical activity per week for good health. Benefits of activity include improved thinking and reduced short-term feelings of anxiety in adults. Regular physical activity can help keep your thinking and learning and judgment skills sharp as you age. It can also reduce your risk of depression and anxiety and help you sleep better. Regular physical activity can also lower your blood pressure and improve your cholesterol levels. Regular physical activity can reduce your risk of developing type 2 diabetes and metabolic syndrome. Physical activity may help reduce the risk of serious outcomes from infectious diseases, including COVID-19, the flu, and pneumonia. Being physically active lowers your risk for developing several common cancers, such as bladder, breast, colon, kidney, lung, stomach, esophagus, and endometrial. Strengthens your bones and muscles, and increases your chance of living longer and helps to manage chronic health conditions and disabilities. So let's get physically active. And another point is healthy eating. Consider these steps to help reduce the risk of developing heart disease. Limit fried foods, processed and fast foods. Increase the amount and variety of fruits, vegetables, and whole grain cereals. Reduce intake of refined carbohydrates and sugars. Limit processed and unprocessed red meat. Trim all visible fat from meat and remove the skin of poultry. Eat oily fish at least once a week. Reduce salt intake. Use unsaturated fats such as olive oil, avocado oil, sunflower oil, or canola oils. Limit alcohol intake. Proper nutrition, a diet full of fruits and vegetables, whole grains, and lean proteins provides your body with the energy it needs to function at its best. These essential foods carry vitamins and minerals that strengthen your immune system and support good health. The benefits of good nutrition for your physical health include lowering the risk of heart disease, type 2 diabetes, and some cancers. May help you live longer, keep skin, teeth, and eyes healthy, supports muscle, boosts immunity, strengthens bones, supports healthy pregnancies and breastfeeding, and helps the digestive system function. Manage your weight on the recommendation of your provider, and manage diabetes with your provider, keeping your blood sugar levels optimal according to your plan. You want to keep stress levels down and manage anxiety. Get plenty of rest, and my favorite, drink plenty of fluids. And here I have a little chart that shows uh, good eating habits. Over here, we have your fruits and vegetables, what to eat. Over here is potatoes, bread, rice, pasta, and other starchy carbohydrates that we recommend. Drinking fluids, about 6 to 8 8-ounce glasses a day. Limit your milk and fruit juices. Here a little bit. Choose oils and choose unsaturated oils and use in small amounts. And here, dairy and alternative. Choose lower fat and lower sugar options. And then here, eat more beans and pulses. 2 portions of sustainably sourced fish per week, and one of which is oily. Eat less red and processed meat. Eat less of this junk here. And occasionally it's okay, but not as lifestyle. And then here is another one of the healthy eating plate. Use healthy oils like olive and canola oil for cooking on salads and at the table. Limit butter, avoid trans fats. The more vegetables, the greater the variety, the better. Potato and french fries don't count, or chips. Eat plenty of fruits of all colors. Drink water, tea, or coffee with little or no sugar. Limit milk, dairy, 1 to 2 servings per day, and juice, 1 small glass per day. Avoid sugary drinks. And eat a variety of whole grains like whole wheat bread, whole grain pasta, and brown rice. Limit refined grains like white rice and white bread. And healthy protein, choose fish, poultry, beans, and nuts. Limit red meat and cheese. Avoid bacon, cold cuts, and other processed meats. Final thoughts. Though we are all at risk, and how we live our lives has a direct effect on our risks. Early recognition and actions or treatments taken can increase chances for survival for both heart attack and stroke. So I hope you have enjoyed this and learned a little something. I know for a lot of people, this has just been a review, but again, it's making you aware that you can do something to help protect your heart. So that's all for right now. And if you have any questions, feel free to email me or call. And here's my contact number. Contact Nurse Beckie, care@derrypres.org. The church is 717-533-9667 or mobile 717-500-6102. Thank you for coming and stay safe. And we'll see you next time.